Okay, this is OSCEs. We're doing blood product administration 2. Robert Crowley is a 67-year-old male admitted for cancer-related lobectomy. He spent his first postoperative night in the intensive care unit on the ventilator. He was extubated this morning and transferred to the medical surgical unit. The blood product for the ordered transfusion has just arrived. Check the EHR to verify the order for the blood transfusion and administer the appropriate blood product. Document in the EHR. The current time is 9:30 on Thursday. Okay, so we're going to go ahead and look in the EHR, and we're going to verify the provider's orders. And we're verifying that Robert Crowley does indeed need 1 unit of red packed blood cells and he needs that now because the time that was put in it was at 9 o'clock and it is now 9:25. So we need to have that administered now, and once we pick up the blood, we'll have it administered within the 30 minutes. We're going to go ahead and go to order results, and we see that in order results, he has B positive blood type, and that his hematocrit is low at 7, his hematocrit is 26%, and it should be at least 37%, and his hemoglobin is 7, and it should be at least 14. So he really needs this blood product. Any contraindications that we're going to watch for is if he has any fluid imbalance, excessive fluid imbalance, or ascites. We don't want to administer the blood product without resolving that first. The lab values have been cross-matched, and his blood type has been cross-matched within the last 72 hours. So we're good to go ahead and pick up the blood. And I also see that he has signed the consent form and that he wants to receive this blood. So we're going to go ahead and gather our supplies and come back into the room and begin the transfusion process. Okay, we're back for the blood product, and we went ahead and performed hand hygiene before we collected all of our supplies. We got a bag of normal saline, we got flushes, we got Y tubing, and we got the red blood cells, and this was B positive for Robert Crowley, and it's not expired, and the packaging is intact. And then we also got a titrated container for the urine. And then we got alcohol swabs. And now that we've picked up the blood, we have to use it within the next 30 minutes. Okay, so we're gonna go ahead and walk in, knock, and I'm gonna come over. I'm gonna perform hand hygiene. Hi, Mr. Crowley. I'm Lee Short. I'm gonna be your nurse today. I understand that you had some surgery, and we're going to go ahead, and that your hematocrit and your hemoglobin values are low, and you need some red blood cells. So we're going to go ahead and give you a blood transfusion. Are you still okay with that? I noticed that you signed that in the consent form. I just want to confirm that. Okay, and you're okay with that. Great. Let me check your name and date of birth and confirm. He states his name and date of birth. Good, so we're in the right place at the right time. Okay, we need to get this blood transfusion going to help you. So some of the things that we're going to look for before we start, or I want to educate you before we start. Once we do the transfusion, I want you to tell me if you have a headache, if you have a fever, if you have any back pain, if you notice any numbness or tingling, if you feel itchy or anything. I need you to let me know, because that might be an indication that your body isn't accepting this red blood. So we want to make sure that everything's okay. So I will stay with you for the first 15 minutes, and I'll measure your vitals to see how you're doing. But after 15 minutes, hopefully everything will be going great, and I'll go ahead and leave the room. The other thing that I have to do is I have to take a full set of vitals on you before we start, and then I'm going to also have a nurse come in and confirm that everything is the way your blood product matches you, and that it's time to give it to you in the order in the unit numbers are all matching. So are you ready to proceed? Okay. So before we start, I'm going to go ahead and do the blood pressure, the temperature, the pulse and the respiration and the O2 saturation. And then once I do that set of vitals, I'm going to come over here and I'm going to document in his blood product blood administration record the before transfusion vitals, temperature, pulse, and blood pressure. So we went ahead and done that. The next thing that I'm going to do is empty his catheter so that we can regulate and control and monitor his urinary output or fluid output while we're putting fluid into him, and to also see how his body is metabolizing and handling this. So we're emptying the catheter. I put gloves on before I did that. I would note the urine amount and the clarity and the color and dispose of it in the bathroom. Make sure that I make note of it on the charting. And then I'm going to do hand hygiene again and apply clean gloves before I work with the blood product. So now we're to the point where the nurse is going to come in, and the nurse is going to is going to verify everything for me. So I'm going to have, why don't you go ahead and put that right here. And face it this way. Okay, so here is awesome Jessica, and she is going to look at this wristband for me. Jessica, this is Robert Crowley, and I want to confirm here that we have the EHR down here, and I want to confirm with you that there's going to be a piece of paper off to the side, and on that piece of paper we're going to have the order number and the transfusion record number. I want you to go ahead and state that number out loud.
Okay, 0049408.
Good, and that matches 0049408. Yep. And then we're going to do the transfusion number.
06936003.
And that matches down here. And then we're going to go ahead and look at the patient's band to verify his name and date of birth.
Yep.
And that matches. And then his blood band also matches the record number and the transfusion number and the order number and the unit number, a whole bunch of numbers, and his blood type. Okay. So let's see, and then I want you to verify that it's not expired.
Okay, it's not expired.
And that this type is compatible for the patient.
Yes, it's compatible for the patient.
Okay, so let's go ahead and document that if you can.
Okay.
And so you would sign, I would sign here, and then you would sign there.
Perfect.
Awesome, thank you.
Okay.
And we'll trade you back again. So let's put that one back here. Okay, and then I would document that. Okay, Mr. Crowley, we've done everything we need to do to prep, so we're going to go ahead and start with the transfusion. The first thing that if the patient had a central line, I would apply a mask and I would put it into the distal port, which is the brown port, and I would verify that that it was patent through a flush. And then but this patient has a peripheral line, so we're going to use this line here and make sure that it's patent. And the other thing that we're going to verify is that the IV size is at least 20 gauge. It can be 18 to 20, so that the red blood cells won't be lysed on their way through. So I'm going to go ahead and get this bag prepped and ready for him. I would open this tubing out of a sterile package, and then I'm going to confirm that the tubing is intact and that the clamps are on and it's tight before I spike it and flip it. So tubing is intact, and so I'm going to go ahead and spike it now. Okay, we're ready to hang. And we're going to prime the tubing.
But this is sticky, so
We're first going to fill this half full so that the red blood cells have a soft landing. Okay. And now that that's done, we're going to go ahead and prime it with the saline.
No.
Okay, I was trying to get all the water, the red out, but it's not going to go out. So the saline is primed, and I'm going to go ahead and lay this next to the patient. The cap would be on. And before I administer, or before I get that started, I'm checking the IV and making sure that the IV doesn't have any redness or swelling around the site. And it looks good. So we're going to go ahead and scrub the hub for 20 seconds.
Okay, you ready?
I'm looking. So
I wonder if I have to have gloves on during this part.
What is it?
I think we should. What the heck? Just to be. I'm going to apply gloves just to be precautionary. Okay, so we're going to scrub the hub for 20 seconds and let that dry, and we did that. And now we're going to take our saline flush, and we're going to push 3 to 5 mils to affirm patency and that there's no resistance, and the line is open and nice. So we're going to go ahead and attach, while we are sure that this is open, we're going to attach our saline IV infusion now. And then we're going to set that at just a slow drip so that we can make sure that that line stays open while we're getting the blood ready. So now we're going to inspect the package one more time, make sure everything's intact. We've already done all the checking, confirming that we need. So we're going to slowly move this 2 to 3 times to make sure that the red blood cells are evenly distributed and haven't settled to the bottom. And now we're approaching. So the IV line is open. We're going to go ahead and lock this up. And we're going to spike the red blood cell. Blood. Flip it. And then we're going to fill the chamber, opening up this one.
keeping it in there.
Okay, so the chamber is full. And now we're going to go ahead and set the pump. We're going to put our tubing in.
I'm gonna just throw you in.
Wait, where?
Ready, man?
No, where?
We're going to say this is the clearing program. This is an adult.
You're just gonna have to.
We're giving blood.
So you signed consent form, correct? So we have your permission to proceed.
We're giving packed red blood cells.
That's it. We're gonna splice.
And this is the primary bag. And we're infusing to start out at a rate of 120 mils per hour.
Just go.
And the volume to be infused is 300 milliliters.
You're gonna die with it. No way.
So we're going to go ahead and run the program. And we've checked that everything. Oh, we've got to open up the clamps.
So you know like how fast 50 minutes is for this one. Okay, so you're on the outside of the room. So go ahead and take this out.
Just give me a second.
Okay, so our fusion rate is going. So we're going to go ahead and stay with the patient for 5 minutes. At 5 minutes, I would do a blood pressure, a temperature, and a pulse. And then at 15 minutes, I would do that again, a blood pressure, a temperature, and a pulse. And at 15 minutes, I would come back to the EHR and document that rate right here, 15 minutes. And it seems like everything is going well. The blood is transfusing nicely. He's having no reaction. So I'm going to go ahead and thank him for his time. Lower the bed, make sure that he can reach the call light, and come back and check on him in just a little bit. And then I'm going to perform hand hygiene and then come back, and I'm going to go ahead and I would chart the time that I completed once the transfusion is over, and then I would go ahead and fill out the rest of this paperwork and his vitals one last time, and then I would save and submit.